Well, ladies and gentlemen, I would like to call upon Miss Karen Howell on stage, and she's going to take us from trauma to triumph and tell us more how we can overcome challenges and live our best life possible. Welcome.
So much information that we've been hearing. I need to take a breath myself. Thank you for that presentation. I want to take all of your information home with me and make vast changes in my home. But thank you. How many of you are ready to hear a little bit about trauma? Yeah, stay. So I'm from the US. I live in Oregon. And for the last 30 years, I have functioned as a psychotherapist. And in the last 20 years, I have found a particular tool that I think is most effective in healing trauma. If you look at, we've heard so many wonderful things about how to take care of our physical body. We've also heard about how to treat depression, anxiety with supplements, with CBD, and I'm going to talk about how you can get to the source of a trauma and heal it at the source so that CBD may not be needed or an anti-anxiety medication may not be needed. That's been my expertise over the last 20 years, and I am happy to share that with you. I'm also very happy to be in India, by the way. I travel here as often as I can. Oh, thank you very much. I travel largely because I am involved with a nonprofit school up in Rishikesh. So the more often I come, the better. So there are two different types of trauma that I want to talk about. Major trauma, we're all familiar with. We lose someone that we love. There's an addiction with a family member. There's mental illness in the family, etc. Those are very obvious. If we've had those happen to us, we know. Ones that are less obvious, I want to spend a little bit more time about. Covert emotional and verbal abuse. So being put down, especially with children. If they are not built up, if they're told they're not smart, if they're yelled at, this is an accumulating trauma. Repeated disappointments is another thing that happens. Feeling like we are not meeting expectations, feeling like we are not good enough. That's over time an accumulating trauma. Feeling constantly overwhelmed. I heard comments about CEOs being up late at night on their cell phones. We are constantly in stress mode. We run into unmanageable stressors, and we may get stuck in an unhappy relationship. One thing that I'd like for you to do, you know, we all get physical checkups, right? Have you been and gotten your checkup in the last couple of years, see how your body is doing? Has anybody gone in for a mental health checkup? You have, awesome. I'd like to just invite you to think these through for yourself, ones that you may not have thought about, but may be present in your life. You know, it's interesting, this is not my final slide presentation, so I'm going to kind of wing it here. How common is trauma? Emotional abuse, 34% of us experience that in our lives. Physical abuse, 16%. Sexual abuse is very high, 15% of women, 6% of men, probably higher than that at this point. Domestic violence, 15%. Substance abuse in the home, 27%. Someone with an active mental illness, 19%. And divorce, 23%. So looking at what are the effects, this is pretty obvious. We've talked a lot about this over the last day and a half, but stress puts us into fight or flight. There's a tiger running at us. We want the adrenaline. We want the cortisol. We want our brain to react. We want our muscles to become strong. We want our heart to beat fast so that we can get away. The issue with that is over the long run, what is that going to do? We're going to be in constant stress mode, and all of those areas of our body are not going to be functioning in a way that they should. Our body, as we know, can heal itself if we give it the right environment, the right foods, the right supplements. It is a magnificent healing tool. So fight, freeze. Has anybody been in a situation where you've gotten some bad news and you just froze? I had that happen to me about a year ago. And I was surprised because I have never had that experience before. that I couldn't think, I couldn't speak. And that lasted for about 24 hours. So our bodies take very good care of us by providing these ways of dealing with stress. The problem is when it's long-term. So I want to give you just a little bit of information about how the brain processes trauma, because it will be important in terms of the therapeutic tool that I introduce. And I am not a neurologist and I'm not a doctor, so I'm going to do this very briefly. The prefrontal cortex is involved in how we remember what happens to us and how those memories process. If we're in fight or flight, our body is busy doing other things. It's busy encouraging us to run and to fight. What isn't happening is that our memories do not process in the same way. They literally get stuck in the part of the brain called the amygdala. And that's where I do my work. The hippocampus is also important for memory processing. And there are ways to process traumatic memories in a safe environment of, say, a therapist's office. And that's what I'm going to talk with you about. So, price of trauma, we're 2 to 5 times more likely to experience a chronic health condition or a serious health condition, 3 times more likely to abuse substances, 3 times more likely to be depressed, and 5 times more likely to be suicidal. So the price is high. So here are some of the options for treatment. Looking at the top-down approaches, cognitive behavioral therapy is basically helping clients to think differently, looking at your behavioral patterns, interrupting those patterns early on so you can choose a different behavior, but it also relies on how are you thinking. Positive thinking, of course, we all know is very important. The other option, and this is what I do, is the bottom-up approach. Let's look at the source. Let's go directly to what is causing depression, anxiety, OCD, etc. And some of the options for that, we've heard about, obviously, yoga, meditation. They're wonderful tools. There's also something called sensory motor psychotherapy, which is using the body to process through a particular response. So for instance, if you get in a car accident, your tendency is going to be to brace, right? You get hit from the side, you're going to brace. And sensory motor psychotherapy is about saying, what is it that your body really needed to do? It needs to complete that action. So we, in the therapy office, are going to allow the client to notice what's happening in their body and do that action. And that can actually release that trauma. I also pay a lot of attention to what my clients are doing. I will ask them, what are you noticing in your body right now? Where are you noticing that? Just notice, just pay attention. And if we stop and slow down long enough, we usually know what's happening. So that's another approach. Comprehensive resource model incorporates spirituality, which is a wonderful tool to use for clients who are so inclined. And then EMDR, that's what my specialty is. I ran into it about 20 years ago. I began practicing it then, and what I found was that it actually will clear a traumatic experience. It's approved for PTSD treatment by the American Psychological Association, by the World Health Organization, and it's widely used throughout Europe and Asia. It was developed in 1989, so it's a pretty new therapy, by Dr. Francine Shapiro, quite by accident. She was a therapist, and she was upset one day and decided to go for a walk. She was in a park, and as she walked down the pathway, she found herself looking back and forth at the trees. And by the time she got to the end of her walk, she realized that she was no longer upset. And as a researcher, she said, what just happened? So she went back and retraced her steps and realized that she was looking back and forth. So the eye movement component is what becomes important. And I'll talk more about that. It's research-based, and basically what it allows the brain to do, like I said, in a safe environment, using eye movements. So I'll sit with the client, and I will move my hands back and forth, and have them follow my fingers with their eyes. What that does is it activates that memory processing mechanism that our brain already knows how to do. But when we have a trauma, like I said, that memory gets stuck in the amygdala. It's like a wound that doesn't heal. It's like we break our arm, but we never get that cast on. We keep using it, it will never heal. So this is an opportunity to take that traumatic memory in the amygdala through the eye movements. It takes it through the hippocampus and reduces the emotional disturbance. And let's see what the next slide is. Like I said, this was not my most recent one, so who knows? So how EMDR, by the way, stands for eye movement desensitization and reprocessing. I don't know why they named it that. It's way too long, but EMDR is what we call it. Basically, the impact of the trauma, something that could have happened 40 years ago, is still there. It's a wound that doesn't heal unless we do something to help it heal. And what happens before treatment, that's kind of taking up way too much real estate in our brain to where our self-respect, our ability to attach and love another person, having positive emotions are diminished. And after treatment, our goal is to reduce the impact of the trauma so that the rest of these can grow back to the normal state. I'm not going to go through all of these because I know it's lunchtime and we're probably hungry, but I do want to talk about how the EMDR process actually works. Looking at item number 4 is the most important. That's the magic of EMDR. So when I work with a client, first thing I have to do, of course, is find out why they're there. They often come to me because I do this particular process. So a lot of the people who come in, they have either an obvious trauma that they have experienced, or they have a behavior that continues to repeat, that is destructive, or that they choose to change. Or they may have an illness. IBS has a lot of a stress component to it. Migraine headaches also do. So however a client shows up saying, here's what it is that I want to fix, that's the first thing we have to figure out. And then we have to find what the source of that is. So if it is, I really get upset when I have to go on the freeway, this particular freeway, I have a panic attack. Okay, so we will do what we call a float back to say, pretend that you are on that freeway, notice what's happening in your body, what are the emotions that are there, and then do a float back to go back in time to when you felt that way before. So we really do a float back on the feelings as opposed to on the experience that they have. And once we identify, oh, that's going back to that particular experience, I will have them notice what is the worst moment. So I ask them to get a picture in their mind because the brain processes in pictures. So we're always looking for a snapshot of the worst moment. That's where we begin step number 4. Before I do that, though, I'll say, as you think about that right now, on a scale from 0 to 10, how disturbing is that to you? It's a 6, it's a 7, it's an 8, it's a 9, whatever it happens to be. And throughout the processing, we'll continue to check in. And my experience is each set of processing that we go through, that disturbance level drops. And I frequently hear from people when we get down to, we started at an 8, we're down to a 2, and they are like, this is weird. How is this happening? And it simply is because we're helping the brain do what it naturally knows how to do in a calm and safe environment. So the desensitization itself, we'll also ask, when that occurred, what was the negative belief that you took on? So for instance, child abuse, someone who was abused as a child often has a distorted negative belief the world is not safe. And then they begin to see the world from that perspective. They begin to look for danger outside of themselves and become very hypervigilant. So another one might be child who was abused. And by the way, I often hear from my clients, yeah, but that was so long ago. Why? That's not still bothering me now. Well, yes, it is if it has not been healed. So looking at a child who's been abused, their belief may be, this is my fault, or there's something wrong with me, or I'm a bad person. And again, that becomes ingrained in who we are, and we begin to see the world from that perspective. That's another piece that we want to change besides reducing the disturbance level. The last thing I ask is, so what do you want to believe about yourself instead? Do you want to believe that you're a good person? Do you want to believe that the world is safe? Do you want to believe that you are lovable? So that's our goal. And I think it's really important piece of the processing that we identify what is that goal, because it plants the intention. And the brain naturally knows how to go there. So you've already identified what problem you want to work on. You know how difficult it is or what the disturbance level is. So I'm going to say, okay, think about that picture, that worst moment. And then I have you open your eyes. And then I have you follow my fingers back and forth. You got to do that part. There you go. And I do this for about 60 seconds. And then I stop. And then I would say, so what are you noticing now? And I'll often hear, well, these are the things I thought about. But really what we're looking for is, oh, well, now I've thought about my uncle when I was 4 years old. Okay, good. Notice that. What I always say about EMDR is that I don't have to do any work. I just keep doing this and watching where they go and allow them to trust the process. And in the session, they're 55 minutes long. And if it's an acute one-time event trauma, it can usually be processed in one session, maybe two. I've never seen it go longer than that. Something more chronic, for instance, when I work with clients who have been sexually abused as a child, I've got one client that was abused from the time that she was 2 until she was 16 by her stepfather. And we identified specific target memories. We don't have to do all of them, fortunately. We just get key memories that were the worst part. We process those. When she came to me, the reason that she came to me is that she was no longer able to perform her job because she was working basically as a social worker with the homeless population in Portland, where I live. And she kept seeing things that were triggering to her because that memory was active in her amygdala. So she'd walk down the street and she'd see a homeless person and she would get triggered. She had to quit her job. Actually, she had to move to a different position. So she came to me to process that because she knew that she was also a recovering alcoholic. And within about, I'm going to say 10 EMDR sessions over a period of perhaps 6 months. I'll have to do them every time. That actually would be overwhelming. But she moved on to a new job, working in an emergency department as a social worker, seeing crisis come in all the time. So she was able to heal enough of that sexual abuse trauma that she was able to change her job and become more fulfilled. So that's a desensitization. The rest of it is we install the positive thought because we've moved away from the negative cognition to that positive one. I'm going to give you a personal example, if I may. So my son's father died when he was 8 years old. He died suddenly of a heart attack. And I did a lot of my own work on that. And 30 years later, I needed to process one part of that experience. And that was when I told him. When I had to take my 8-year-old and tell him that his father had died the night before. And I had to go in and process it. Did it in one session. And when I began the processing, what I saw was him as an 8-year-old. When I completed it, I saw him as now 37 years old, as an adult, and my positive belief became, we got through it. Before, my negative belief was, oh my gosh, I can't do this. I can't do this. But by the end of that one session, I was like, we did get through it. And that's often how things resolve. The left and the right brain don't talk to each other very much when there has been a trauma and we've stored that traumatic memory. It kind of gets locked up, closed up. What we want to do is allow new information in. And that new information was, for us, oh, he's grown up. Somehow we managed. So that's basically EMDR, and it's faster than other therapies. Like I said, you can process a one-time event in 1 or 2 sessions. I think they've done studies that say combat veterans with PTSD, it takes about 12 sessions to complete their treatment. So it's fast. The other thing that's nice about it, anybody who doesn't really like to go to therapy and talk about things, you don't have to talk about it. All you have to do is think about it inside and then allow the process to work. So it's a fabulous tool for someone who is not going to go into a therapist's office and talk through a problem. In fact, oftentimes that makes things worse because it reinforces the trauma. So I've already talked about the case of child abuse. Let me tell you a little bit about a few other cases. So I worked with a male, I think he was around 50 years old, came to me because he had a phobia of doctors and nurses. And he had to have surgery. And so he came and said, I don't know what this is about, but I need to get through this so I can go have my knee replacement done. And I think I saw him 5 sessions trying to figure out what's going on here. He finally said, oh, you know what? When I was 5 years old, I had open heart surgery. Well, there you go. All right, now we know what to work on. And I think it took 2 or 3 more sessions. And the trauma that was stored for him was that his mom was not there with him. Of course, he went into surgery by himself. He was terrified. And as soon as we got to that piece of the memory, he began to cry. And by the end of that session, the trauma was gone. So it can be very effective. Another one I'll tell you about is I worked with a first responder, so a firefighter. He had gone into a bank building that there was an explosion. Somebody had planted a bomb and it had exploded. When he walked in, he saw his best friend literally blown in half in front of him. And I honestly said to myself, I don't know how this can possibly process. But I'd been doing EMDR long enough that I thought, I'll trust the process. Let's just see what happens. And we worked 5 sessions on that particular event. And lo and behold, by the end of that 5 sessions, when I would ask him to think about that experience, he said, you know what? My friend is no longer laying there. I no longer see him. So that was what his brain did to process through that trauma. And I think that probably was one of the moments that I really realized EMDR is a very, very powerful healing tool. Our emotional well-being is extremely important to our physical well-being. It will eventually catch up with us if we don't take care of ourselves emotionally. So you do have EMDR therapists here locally. There's an association. The information is up there. I would leave you with that. So if you do have a loved one, or if you have had an experience yourself, you don't have to live with the result of a trauma. By the way, not everyone ends up with PTSD if they have experienced a trauma. If you've had a very solid childhood, lots of love, lots of connection, a lot of people in your life, lots of good self-esteem, you're going to be able to get through much more stress and trauma than someone who perhaps was born into a family that was not loving, not supportive. Perhaps there was some abuse going on or addiction. So I don't want to have you walk away thinking, oh, I've had something like that happen, therefore I am traumatized. But if you do experience something that you think about from time to time that produces negative behaviors that you don't want, I would really encourage you to contact these folks. It's not magic, but it's pretty close to that. So I'll wrap up with that. Let's go have lunch. Thank you.